Good afternoon and welcome to the 37th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. These calls are held every weekday at 5 p.m. Eastern Time. My name is Scott Knowles. I'm a historian of disasters at Drexel University in Philadelphia. Today we have a public health update with Esther Chernak, then a discussion with Disaster Research Center co-director James Kendra. We're streaming on YouTube Live. You can also keep up with COVID calls via Twitter. You can find me on Twitter at US of Disaster. You can also hear the COVID calls recorded as podcasts. Just go to soundcloud.com and connect to the COVID calls podcast. Please do help spread the word about COVID calls and send suggestions for future guests and topics. And please do suggest yourself if you'd like to participate. On Wednesday, I'll be talking with an old and treasured friend, Chuck Strozier. Chuck is an expert on terrorism, on apocalyptic thinking, disaster psychology. We're going to be talking about COVID-19 and these many issues around apocalyptic thinking. As of today, there are 3,640,835 confirmed cases of COVID-19 globally, according to the Johns Hopkins University Coronavirus Resource Center. This is up from 3,562,919 cases yesterday. 1,194,494 of those are in the United States, up from 1,172,670 yesterday. There are now a total reported 70,272 deaths in the United States from COVID-19, up from 68,326 deaths reported yesterday. And you may remember a couple of weeks back, I talked with Lori Peak, and she talked about those numbers and the importance of hearing those numbers every day. But we also talked about the importance of hearing human stories, and others have written to me and have expressed that same desire. So I started yesterday reading an obituary, and I'm gonna keep that up. I'm gonna read you one today that was just in the New York Times. Daniel and Valerie Zane, married 71 years, died 2 days apart. Daniel Zane fought in World War II. In a way, it helped prepare him for the painful time in mid-April when his wife of 71 years, Valerie Zane, was dying. He used to say, "I survived the Battle of the Bulge. I can survive anything," his son-in-law, Greg Hetwer, recalled. But he could not survive the novel coronavirus. He died of it on April 17th at 94, just 2 days before his wife, who had been in declining health for 7 years with Parkinson's disease and dementia, died at 91. She had not been tested for the virus. The two were in a senior living facility in Haverford, Pennsylvania, outside Philadelphia. When the pandemic forced restrictions, Mr. Zane was no longer allowed to walk from his independent living unit to visit his wife in the skilled nursing unit. So he moved into a small apartment in the nursing unit to care for her. He then tested positive for the coronavirus and could not see her, which left him distraught. She was dying, and he knew he couldn't save her. A terrible blow for a man who had always been so capable. While in the Army, where he proved to be quick on his feet and a natural leader, he did reconnaissance work behind enemy lines and then helped liberate concentration camps. After the war, he went to Fordham Law School and practiced law in Manhattan. He married Valerie Zuckerman, whom he had met on a blind date in 1949. They moved to White Plains, New York, where they raised their two daughters, Robin Zane, who is married to Mr. Hetwer, and Nancy Zane. Mrs. Zane worked as a medical administrator and was a master bridge player. So we're going to move to our discussion today. We have a great discussion today with Esther Chernak and with Jim Kendra. You're familiar with Esther Chernak by now, but if this is your first time tuning into COVID Calls, let me introduce her. She's Associate Professor in the Department of Environmental Health, the Drexel University School of Public Health, Dornsife School of Public Health, and the Drexel University College of Medicine. She's the director of the Center for Public Health Readiness and Communication at Drexel, and she worked for 25 years at the City of Philadelphia Public Health Department. Please get your questions in for Esther Chernak using the YouTube live chat function, or you can email them to me directly, sgk23@drexel.edu, or you can send them to me on Twitter. Just tag me at US of Disaster. Esther, thanks for coming back to COVID Calls.
My pleasure.
So can we start, as we have been, give us an update on Philadelphia?
Well, it's an interesting time in Philadelphia. I think today the health commissioner announced that the city has over 16,000 cases from a cumulative perspective and around 750 deaths. But the hopeful news is that we believe that the peak, the so-called peak of this, is behind us, at least for the moment. And if you know, in the last couple of weeks, we are seeing somewhat fewer cases reported per day, somewhat fewer deaths reported to date. I think one of the more notable things is that it appears that the percentage of positive tests has gone down. So some of that reflects we're testing more, but ideally it might reflect some decrement in the numerator as well. That, you know, we often look at the percentage positivity as a marker for activity. So I think the hope is that the worst of this is behind us. The bad news within that is that we're at a pretty high rate. You know, we talk about the peak being behind us, but today there were 370 new cases reported and 17 new deaths reported. So from a plateau, that's quite a high daily rate. And so we still have quite a ways to go before we start to see really diminished, you know, transmission in the city. I think that in Philadelphia, like the rest of the country, but perhaps maybe worse in Philadelphia, certainly Pennsylvania, we're still seeing huge amounts of clusters in nursing homes and congregate care facilities. There's not a lot of granularity in the data that's being posted to the public website, but I'm interested in knowing to what extent these hotspots, particularly in long-term care facilities and congregate care facilities, are driving our local transmission. And that'll be important, I think, as we think about what lies ahead of us and how do we really manage this now.
I have so many questions for you about the statistics. Just let's stick with Philadelphia for a second. As you understand the case rate, it's also got to be connected to the social distancing, right? Mm-hmm. And the degree to which people are following the instructions of the mayor and the governor.
Yeah, yeah.
So if that changes, then we can expect a change in the infection rate?
I mean, that's the driving assumption behind all of the models. And you were asking about this before the call, you know, how do we think about the models that have just come out with widely different expectations for case rates and death rates? But a lot of the assumptions are that the social distancing we do will make a big difference in terms of driving our case counts. I mean, the challenge here is the lag between when we undertake these health protective behaviors like social distancing and when we start to see reductions in transmission, reductions in case counts, and then reductions in hospitalizations, and then eventually deaths. That can be 3 to 4 to 5 to 6 weeks later, which is why it's a challenging thing to measure, but also to implement, because it's certainly not the kind of thing where you have immediate satisfaction when you do these things.
Just for somebody like myself who's learning a lot of public health as we're going through this, it's not just the presence of the virus, the length of time it's been in the population. Those are not necessarily the factors we should be looking at right now. We still need to be looking at these direct sort of behaviors that people need to exhibit. Is that right?
I mean, yeah, I think, you know, we talk about how do we diminish the amplitude of the epi-curve? How do we reduce the number of cases? And I think the big one that most people agree upon is decreasing mobility in a population, which is another way of talking about social distancing. And it's everything from staying inside your house and sheltering in place to decreasing mobility within your jurisdiction. And when we talk about US cases, we're also talking about, you know, decreasing mobility with respect to allowing international travel or preventing international travel in those imported cases, and also talking about reducing interstate travel where there's hotspots in some states and not so hot spots, but, you know, interstate travel, you know, allowing, you know, transmission across state lines. So that's probably the biggest thing that we can do at the moment in the absence of a vaccine or an effective medication for post-exposure, even pre-exposure prophylaxis. You know, there's, you know, related to that is the strategy of targeted testing, expanding testing, and targeted, case identification and tracing. I think of that as a relative of social distance, but it's a much more precise, targeted way of limiting transmission from person to person.
So I was looking at different kinds of measures last night, and one of the things I was looking at was infection rates, but also ICU bed occupancy. And I don't know if you probably keep up with these numbers every day, but I was looking at some states that have had increasing infection rates, like Georgia, for example, and Nebraska, still have very low ICU occupation, whereas New York and New Jersey, which seem, it's not flatten the curve, but maybe there's a slowdown, they're still at like 90 to 100% ICU capacity. Can you work that in a little bit and help us understand why that's relevant?
So I think a couple things account for that observation. I think in some of these states that are, relatively speaking, early on, compared to say New York, New Jersey, which have had pretty established epidemics for weeks now, you're not going to see a consumption of ICU beds early on. It's going to be this exponential increase. And so I think we need to look at those states 2, 4, 5, 6 weeks from now, when we really start to see the consequences of unrestrained, uncontained transmission in those states that right now might have relatively low or low-ish case counts. I think that could change. I think we may see more ICU beds taken up. The other challenge, the other side of the coin, in states that have had pretty significant sustained transmission for some time now, or even now hopefully decreasing transmission, is that one of the challenges in this disease is that people develop respiratory failure and it lasts a long time. People end up, the sequence of events here is that, there's an illness occurs, it can, after usually, 4 or 5, maybe up to 14 days after exposure. And then there's an illness that lasts for about a week or so. And typically the deterioration that results in respiratory failure occurs in week 2 of the illness. And then a certain percentage of those people end up in hospital and then in intensive care unit beds. And many of the people who require intensive care unit stays and mechanical ventilation remain on ventilators for a long period of time, weeks. And that's particularly true of elderly folks with respiratory failure. So when you see states and cities that seem to be on the declining end of their epidemic, their ICU beds are not emptying out because they're still caring for people that developed disease 4 and 5 weeks ago. That's one of the tragedies of this pandemic.
So then, are we paying attention to the wrong? I mean, it's like sometimes the daily description has become almost, I think, for some people like a weather forecast of sorts. We're like, well, it's up today, it's down tomorrow. We feel like we're on top of it because we're reading the dashboard of the number of cases. You're describing something that we should be looking at the longer tail, 4 weeks or 6 weeks. Maybe this ICU occupancy is a better measure even than infection rate somehow.
Well, I think new hospitalizations tell you something about new cases, albeit there's a lag in that measurement. I think looking at hospitalizations and hospital bed capacity and ICU capacity tells you something a little bit different. If you're a healthcare planner trying to figure out if your healthcare system has the capacity to care for new cases, you need that number. It's not a way to be on top of the epidemic in terms of new events, if that makes sense.
I see. So I wanted to ask you, ever since yesterday, I was so glad you were coming on today, because the New York Times broke this story last night and they leaked a report that is an internal document from HHS and FEMA and CDC that paints a very different picture from what we've been hearing, not only from President Trump, but also from Dr. Fauci and others who have significant credibility within the administration, saying that among the many things that the report says, it paints a picture that says we could be expecting somewhere around 3,000 deaths a day by June in the United States. We're already at 70,000 deaths. So we've gone well past that low number that Dr. Fauci put out a couple weeks ago, 3 weeks ago, I guess, up 60,000. I mean, obviously it's very complicated, as we were just discussing. There's so many factors, but were you surprised by that report? Were you expecting those kinds of numbers? How do you interpret this new very grim picture that's been painted for us? Leaving aside the issue that we've been told we should go back out and reopen everything. Yeah. We'll get to that. But just the report itself and those numbers, are those startling to you?
Yes and no. I mean, there's a number of different models that I think became public yesterday. And I think you're citing one of the most dire or grimmest ones. I think that was the report that came out of Hopkins. The IHME updated their projection, and they were the original ones, or one of the earlier ones that had predicted 60,000 deaths by August. I think it was clear. It's been clear for several weeks that was gross underestimate of what, what was going to really happen. Their new projection is probably more realistic, and that might be the right place. I think, all of these models are only as good as the assumptions on which they're based, and that's what changes all the time. It's the degree to which we are effectively as a country employing social distancing and other containment strategies, and the lack of predictability about how that's going to play out across 50 states. And even within states, you can see, if you look at the CDC maps that were published in the last couple of days, even within states, there's huge variation in terms of the trajectory of the epidemic in different counties. So at least they, I think some of the revisions have to do with a more realistic estimate of the efficacy of social distancing as it's being implemented. I think probably there was a huge underestimation of the hotspots and the degree to which these hotspots are driving community transmission and just case counts, and as well as deaths. And so I think the 60,000 number was aspirational. I think for weeks now, it was clear that that was a gross underestimate. I don't know what the right number is going to be. I'd like to think that all of these are too high, because if the reality was much better.
Right. The hotspots you're mentioning, these are places like the nursing homes, the meatpacking facilities, the places where you're all of a sudden getting 200 to 300 cases all at once. Yeah.
Yeah.
There's something you just said that's been on my mind too. I mean, I reached a point, I don't know, at some point where I started to think 60,000 people dying from this over 10 weeks was somehow acceptable. And I worry along those same lines that 100,000 will become acceptable and 200,000 will become acceptable. I mean, you're an expert in this. How do you maintain alarm? I don't know what other word to use. I mean, if we just decide that this is an acceptable trade-off, even in states that have been pretty vigilant about social distancing, we could, it seems like, come to a place where people will just come to accept this as a kind of normal thing. That's my real worry right now. And I'm not a conspiracy theorist, and I think it's all right there in the open. I feel like the administration really kind of does want to habituate us to this to a certain degree. I don't know how else you explain the increased number of deaths, the clear evidence, and also the advice to move away from social distancing as a practice.
The numbers are numbing. I agree with you. And I think there's a danger in just, sitting inside an office and counting cases and looking at epi curves and being too removed from families who are, sitting with loved ones who are sick and dying, and being removed from healthcare facilities. And you just sort of have to remember that there's a reality to this. It's not just, I hear politicians on news shows talking about there's a certain number of deaths we're just going to have to tolerate to save the economy. And that's a trade-off we shouldn't be asked to bear. We are better than this. And we can come up, I'm not an economist, and I don't know how to rescue the economy, but we should be able to make investments in public health management that don't require us to make these trade-offs. I mean, social distancing is the behavior of last resort when you don't know when you don't know how to manage things and you can't find cases. And we know what we need to do to identify cases and identify contacts. It requires an enormous effort, probably nothing like we've ever done in this country before, but it's doable. We understand how to do it conceptually. We've seen other countries do it. And the crime here is that we're not doing it as a country. Here we are months later, mired in increasing case counts.
I mean, I read this afternoon, though, that the administration is potentially winding down its coronavirus task force, and I don't know how to read that. I mean, is it your sense that the American public is already numb to a certain degree, or in public health generally, there's been this sort of diminution of expectation over time, or something that people could possibly think this is okay, acceptable, just the way it's going to be for America?
I don't know how to read that move. And I don't, there's clearly a couple of very different schools of thought in terms of the way people are looking at this. And I have to think that that's not going to be static. that
Mm.
as this epidemic moves across the country and affects communities that maybe today aren't as hard or aren't as, greatly impacted, that attitudes will change. It's just unfortunate. Not everything is going to happen concurrently. And so you're going to have different parts of the country experiencing this in different ways. And I think when it looks like it's someone else's problem or some other part of the country's problem, it's easier to say those things and open up your borders, et cetera. I also think, I think we have this draconian approach to social distancing, which is absolutely crippling the economy and very difficult to endure. But we're not doing what we need to do to allow us to step back from that. We're not ramping up testing in ways that really allow us to be much more sophisticated and targeted around this, so that we have to just shut ourselves inside our houses and not go out to diminish transmission. And that's what's so frustrating. We all want to stop the social distancing. We think we know what we need to do to be able to ratchet it back, but we're not doing that. And that's what's frustrating from my perspective.
Well, that seems like a missing piece here that actually has a really important political valence to it, which is, protesters in Minnesota or in Michigan or in Texas who are demanding the end of social distancing. Based on what you just said, it seems like their signs should say, we demand contact tracing now, which is to say, we want to move away from social distancing, and let's do it in a way where we can have some confidence that the science will protect us. I mean, you've been following this pretty closely. Why has that demand, a demand we might make of government, why is that not being articulated as forcefully as it could?
So I think it depends on who you're listening to. But what I think, and I
listen mostly to Fox News, so you'll have to just.
But what I think is, I think this is the Achilles heel of this administration, their approach to this pandemic, because they're saying we have enough tests, everything is fine. And if they acknowledge that we don't have the right amount of tests to do what we need to do to back off on social distancing, that'll be an embarrassment, a public recognition that we haven't done the thing we need to do to get us out of this nightmare. I'm not sure. But to me, so much really depends on our ability to find cases. And we need to test people who aren't sick. We need to detect the mildly symptomatic. We need to detect their contacts of contacts. We need to over-test to figure out where this is and confine those folks so that we can come out of our houses and open up stores again and function as a society. I agree. To me, it makes some sense. And I feel like I'm reading that and seeing that some people are saying those things, but you're right. There's a substantial part of the country that's sort of glossing over that, because we would have to confront the fact that we haven't solved the logistics around testing. And that's a huge gaping hole.
Yeah, I want to know a lot more about that, because that does seem like if your impulse is to demand of government a change, that's a very good demand. And it's one that has probably been anticipated in California and certainly in New Jersey and in New York and Connecticut. Watching this play out is basically, to me, seems like watching 50 different countries deal with a public health emergency. And it's too much to keep up with every day, I think. But thank you so much for your help in helping us do that. And we will have you back as soon as your schedule allows for it. We appreciate the time you spent with us today.
Thanks, happy to be a part of this.
So now we're going to turn to my second guest, Jim Kendra, and let me introduce you to him. Jim is professor in the School of Public Policy and Administration and director of the Disaster Research Center at the University of Delaware. Previously, he was coordinator of the Emergency Administration and Planning Program in the Department of Public Administration at the University of North Texas. That's where I first met Jim Kendra. His research interests focus on individual and organizational responses to risk, improvisation and creativity during crisis, post-disaster sheltering and housing, and planning for behavioral health services. Jim has participated in several quick response disaster reconnaissance trips, including the 2001 World Trade Center attack, 2003 Midwest tornadoes, Indian Ocean tsunami in 2004, and Hurricane Ike in 2008. But he keeps up with every disaster of our time, as well as documenting maritime relief efforts in the United States. Following the 2010 Haiti earthquake, he is co-author with Tricia Walkendorf of a really remarkable book, which I hope everyone will check out, American Dunkirk, The Waterborne Evacuation of Manhattan on 9/11. Jim, Kendra, welcome to COVID Calls.
Thank you for inviting me.
So let me start by asking you, where are you calling from and how are things where you are?
Well, thank you for asking. I am calling from Newark, Delaware. That's where the University of Delaware is. Probably like many people, certainly many people who are in academia and elsewhere, I have been physically distancing at home for the last couple of months, except for forays out for necessary supplies, and now well masked at grocers and so forth. And you know, as everybody else, looking to see what the trajectory of this is going to be over time, as we're probably entering our 7th week, I guess, of this or something like that.
Well, we've been very lucky to have Sarah DeYoung, and we've had Valerie Marlowe. We will have Jennifer Trivedi and also Tricia Wachtendorf. So I'm getting, you know, we're benefiting in this discussion by the expertise that you have all collected there at the Disaster Research Center. But you've been on my mind a lot there because, you know, the signature of the Disaster Research Center is a sociological disaster research methodology of rapid response field work. And that's been really kind of a signature of your own career. Must be very counterintuitive to you in the middle of this disaster to be at home.
Well, we have been able to adapt to that a little bit. So about a week or so, maybe a couple of weeks ago, we inaugurated a community-wide study of adaptation, focusing initially at the university and then broadening out to the wider Newark, Delaware, and then the environs around that, where making use of Zoom, we are meeting with faculty, with members of the community, with with others, to try to document what their experiences have been over the last several weeks or couple of months of this event. So it's true that DRC was a pioneer of quick response disaster research, which did often involve travel. In this case, it doesn't, but it is still, at least in our view, just as important to document people's experiences during this ongoing kind of event. It's important for the historical record. It's important for science. It's important for being able to distill out particular challenges and lessons that might even be applicable while this event is going on. Once we have a chance to do some analysis. Sadly, there will probably be, according to most estimates, a second wave of this, where anything that we learn might be valuable, maybe sooner than we would prefer, actually. So we're still keeping to the tradition of DRC's response methods, but like a lot of things, we've had to adapt that as well.
Fascinating. I want to come back to some of the archives of DRC and draw a parallel maybe later to nuclear planning and nuclear attack. We'll come back around to that. But I wanted to ask you, this program is called COVID Calls. And I haven't mentioned this in several weeks, but I called it that at first because after disasters, in the midst of disasters, the way I often work is literally pick up the phone and call people who know a lot more about disasters than I do. And you have over the years been one of those people who's been kind enough to answer the phone. So I want to ask you a very open-ended question right now, which is that, looking across all of the different ways that this disaster is reflecting society, shaping a new society, if it's communication, if it's disaster planning, if it's economic impacts, where is your antenna right now on these things? Where are you seeing new things? Or where are you seeing things we knew reinforced that we should have known better? Take us inside sort of what's in your mind right now.
Sure, and it's I guess it's all of those things, because in some ways, obviously this is certainly a not recently precedented event, but on the other hand, we do see a lot of similarities to what we observe in other kinds of disaster responses, whether they emerge from catastrophic storms or seismic calamities, and so forth. So, as you know, one of the things that we focus on a lot and have focused on a lot at DRC is aspects of emergent behavior, aspects of improvisation, aspects of people coping. And we've seen that in many different ways, throughout our local environs, where restaurants, for example, have shifted their menus to takeout only, or they shifted to delivery, or they're selling groceries, or in one noteworthy case, one of the restaurant owners has turned his employees toward doing like minor home repairs and so forth to sort of to keep them employed during the time that that business has slowed down. So we see a lot of similarities as far as that goes. We certainly see the same emphasis on the need for communication that we see in other kinds of events. The need for communication to come from sources that are trustworthy to a particular constituency, that are that provide people with a clear indication of the risk, that provide people with action steps that they can actually take. So all these things that are well documented from the literature for decades are also are showing up now as being just as important. So although the nature of the the hazard agent, the virus is different, a lot of the response attributes are the same, and that's something that that the pioneers of the field, Dines and Quarantelli, would have talked about with their idea of agent generated versus response generated disaster demands, which is not to say there aren't, obviously there's important differences, but nevertheless a lot of what we see is also familiar. So in some ways that could or should help us to get our bearings even in an unfamiliar event like this. So we have seen emergent activities, we have seen improvisation, we have seen adaptability, we've seen logistics problems, just as we would see after a catastrophic hurricane like in Puerto Rico a couple of years ago. In many ways, what has struck me is how this has been converted to a logistical and supply chain event as much as a biological event. Where are our masks? Where are our ventilators? Where are our gowns? Who's got them? Who can make them? How can we drive them there? How can we harvest the food that's moldering in the fields and in different places? So it certainly has a a biological dimension to it, but also very much a supply chain problem, a logistics problem. And it struck me that when FEMA was appointed the lead agency along with HHS a few weeks ago, that partly that was in response to the fact that this is a logistics thing, and that potentially FEMA would have expertise at mobilizing resources on a national scale. So it's not a completely unfamiliar event. Not to say that there aren't some very very substantial unfamiliar challenges, of which physical distancing is one of those, obviously.
So what you're describing then sounds to me that in many areas the social science is bearing up pretty well. The areas of research that we've been fascinated with now for a while, improvisation, for example, sort of emergent capacity of organizations, things like that. But I still hear this word unprecedented thrown around a lot, which of course as a historian always makes me a little anxious, but
and I'm always worried about saying that word to a historian, actually, because, nothing is unprecedented. The world has ended many times before.
Sure.
It just depends on our
scale.
But I take that point.
But let me come to an area that I think is worth thinking about, and this you mentioned just a second ago, FEMA becoming a lead agency. I would like to hear your take on the response, the governmental response, federal, state, local. It does seem unprecedented to me to have a 50 state and 4 territorial response. I don't know if we have anything like that, or if we've even seen decent planning for something like that. It seems almost to have been beyond the imagination of the planners? I don't know. How are you feeling about what you're seeing with the response?
I think that, well, it depends. So a complicated question. And I think it depends on the, on the scale that we look at. But one of the things that repeatedly occurs to me during this event and in other events is how our so-called system for managing calamities at this scale is, I guess, virtually designed to fail. We have expected a pandemic of this sort. People have thought about it for years. There was the Crimson Contagion exercise that was done last year that was reported on by the New York Times, which predicted in very great detail with great accuracy many of the challenges that we're seeing now. So this event was predicted, it was foreseen. Hurricane Sandy was predicted, it was foreseen. Hurricane Katrina was predicted, it was foreseen. And yet we continually observe the same kinds of interorganizational breakdowns, the same kinds of failures, the same large expectations that are placed on FEMA as sort of being the face of emergency management, which is really beyond the ability of that agency to handle. I think we're seeing the effects of years of failure to learn from event to event, which I think in large part is due to the kind of outsourced system of emergency management that we have in the United States, where basically FEMA and other agencies act as contractors for other kinds of agencies or organizations that actually do the work. That they're continually spun up for a disaster and then wound down again. So there's a repeated loss of organizational continuity and learning over a period of time. We place expectations on FEMA, on the FEMA administrator, like that person can act as like an emergency management general who will like direct a smooth and perfectly synchronized disaster response. But we really don't take these things seriously in the way that we take other organizations seriously in the United States. We take the Army seriously. We don't disband the Army, every 5 years. And that's not how we treat disaster management. We treat disaster management as if it's always a one-off kind of a thing, like there isn't a disaster everywhere at some time. So in that sense, to circle back to your question, the response is disheartening, but not surprising. And again, I think stems from the fact that we just don't take hazards seriously. We don't take risks seriously. We don't take FEMA seriously. And that is that's a flaw in our overall emergency management philosophy in this country. So
I asked a similar question of Kathleen Tierney, and she gave a very similar answer, and she talked about all of the planning that had gone across every different agency and every different imaginative. And you said that the fantasy documents, they're planning documents, but fantastical documents like Crimson Contagion or Hurricane Pam back in 2004, and yet the same errors and the same lack of capacity to move knowledge across different administrations. So what does that say to you? I mean, what does that say to you more broadly about the United States? That it's the calculation? I mean, should we just do this as simple cost benefit analysis and it's just cheaper to not be prepared and pay for it on the other side? Or is there something that's just harder about disaster knowledge to pass along? I'm still trying to get my head around why these are such difficult problems to manage across time.
Part of it, I think, is the fact that our style of managing an emergency is done through these network systems that normally are separate, but that are supposed to come together in a disaster through documents and protocols like the Incident Command System or the National Response Framework, or or others. And that style works in principle, but when it comes to actually doing the work, there's a kind of a breakdown, and it almost reminds me of like a video game where, if you're like, I used to be a merchant seaman, so I've played with like maritime video games, and at a certain point you get to the end of the simulation geography and you just kind of hit a blank wall, or like in the Truman Show where like it just ends. And so in a sense, our exercises and planning just kind of reach this end point. So as an example of that, reading through the Crimson Contagion report, which again the New York Times published a couple of months ago, one of the disconnects was as follows: the Office of Personnel Management was supposed to interact with Department of Health and Human Services and make a recommendation for the kind of physical distancing that government employees should do. But for some reason, that contact wasn't actually made during the course of the exercise, which could be because nobody knew who they were actually supposed to contact. Like when it comes right down to it, who do I call on the phone?
Right.
Like which actual person? Yes, it says that I'm supposed to contact somebody, but who? And if you don't know, and if that's never actually been done, then the plan is actually broken at that point. Now, magnify that example by thousands of times at the federal level, at the and at the state level. So things that are networked together, which we know from public administration theory, take a lot of monitoring and oversight and constant working of a system in order to make it actually function. And even then, it's challenging. And even organizations like the military run into difficulty when you try to get the Air Force and the Army to work together, when you bring in reservists afterwards. And this is a single organization with well-trained people who spend careers advancing in rank and are similarly acculturated. Now, imagine that in our fragmented disaster management system. How can that work?
That was exactly what I was going to ask you, is that if this sort of line and staff, functions in boxes is the way that it's sort of written, and then we expect real humans to step in there and act, then that seems to work in the military. But you're saying actually maybe not. Maybe looking at the military as a success story of this kind of planning is the wrong way to think about it.
Well, as I said, I mean, there's certainly been breakdowns. It's not a perfect story, but it is a story of what a single organization does when the people have worked in it for a long period of time. So to take the theme administrator, like we've had multiple theme administrators who are in office 6 or 7 years, maybe at the most. Now you take an Army general who's been in 30 years. Right. Before they manage a sizable campaign. So I don't want to excessively talk about military examples, only to say that that's an organization that the United States takes seriously.
Right. Okay, I see what you're saying. And your point about continuity of knowledge is really important. And to me, Dr. Fauci has been an interesting person to see in this, right? Because he has this he's well known in the agents, his trust is established, and people might take some issue on any given day with how he communicates or what he's doing, but there is that sense of a continuity. I didn't plan for us to talk about this, but I'll share something. I was, a few months ago, I was visiting Gettysburg Battlefield and Antietam Battlefield in Western Maryland, Western Pennsylvania. And the Antietam Battlefield has been used since the Civil War, was used for a long time as a training battlefield. I thought that was really fascinating, that part of military officer training for a long time was to actually do this very deep dive into sort of historical examples and to find relevance in them. And I've worried about that. I had not put that together with what you're talking about right now, but this sense in which, with this incredibly fast turnover in these agencies and not enough training and communication across, how can we expect them to not have to rebuild it every time something happens like this?
And I think in part that's that's what it is. Even though the agencies are the same,
Yeah.
there's often turnover of individuals. We just have not been very good at sort of encapsulating all of that knowledge, or in being able to take what we learn in these exercises and then actually make corrections. So you mentioned Hurricane Pam, right? And the exercise in 2004, and which again predicted much of what we actually saw in Hurricane Katrina. But 2004 to 2005, a year's period of time is probably not enough to unravel all of the difficulties that exercise would have revealed. And similarly with with Crimson Contagion last year, maybe that's 5 months, 4 months before COVID was detected in the US. Again, certainly not enough time to unravel a lot of the I guess, or to ravel the disconnects that were identified. So one thing that I think we should certainly be thinking about now is how we can capture a lot of, and I don't want to say lessons learned because they've been learned 50 times, but how we can better apply what we know that that we might take away from this.
You were one of the first people I ever talked to who very consciously talks about economic recession in the same sentence that you might also talk about an earthquake, or I mean, you take a very broad view of disaster as something that overtaxes our systems. And I know that coming back to this issue about having a system designed to fail, I worry about that right now as we see the pandemic and the economic recession intermingling, and as we start to see some of the cracks in not only the healthcare system, but also the sort of social safety net. What are you seeing there that is concerning to you? I mean, even down to the level of how people get disaster aid, for example.
One of the things that I observe, and I think not unique to me, is how precisely this crisis has revealed the weaknesses in our entire social structure in the United States in many different ways. It seems to have it has revealed vulnerabilities in a way that that many of us knew, but I think other people were probably not aware of, and that's that's now been exposed. And it shows the difficulty of really responding to to an event like this. So one thing that struck me, there was an article in the New York Times a couple of days ago, I guess over the weekend, and it focused on the processes in a number of states for people to apply for unemployment insurance. And applying for unemployment insurance is one of the main ways that people will access the the special funding that's been provided by Congress for for this event. And in these states, according to this to this article, the process is really made to discourage people or to make it difficult for them to access assistance. It assumes that everybody's trying to scam the system. So there are a lot of obstacles to to people to to accessing this. And it just shows how inept our systems are when we really need to use them for disaster assistance, because they are predicated on the assumption that people are trying to game the system, or they're too lazy to work, or or something along those lines. That's the usual operating norm, and it is just not that easy to reverse that norm in the middle of an event like this. So those systems almost have a punishment mentality in a lot of ways. The systems that New York Times is talking about, or periodically you'll see that states try to implement drug testing regimens for people who are receiving public assistance.
Right.
Those, again, there's a sense that people who need help are have to be shamed, have to be punished. It has to be made difficult for them. And a system like that is totally not suited for disbursing large amounts of money on short notice. We've seen in this event, just as we observed previously, how powerful economic interests managed to zorp up assistance money that was, intended for people of lesser economic means. We saw that after Hurricane Katrina. We saw that after 9/11, saw it after Hurricane Sandy. So again, over and over, these disconnects or this maldistribution of assistance goes toward powerful interests to the detriment of others. But once again, we don't seem to learn that. There's no continuity of knowledge, and of course, there's very substantial and powerful political forces behind that as well. But it shows just the fragility of our system. And by the way, I mean, even in excellent conditions, to try to get $2 trillion into the economy in like 4 weeks was probably going to have some problems.
Absolutely. And not to ask you to take apart and then put back together our entire political economy in 5 minutes, but I kind of want you to, because there's so many pieces of this to pick up. You're talking about systems that are in place in the federal and state level that make it difficult for people, sometimes logistically, sometimes through use of language, sometimes through just, as you say, the sort of moral judgment almost of people receiving benefits. And by the way, that extends also to FEMA disbursements as well. So this is not just states, this is federal. And yet at the same time, we have the relief funds coming out, and all of a sudden I see headlines about companies that are giving back the money, the famous steakhouses or famous, retail outlets. Because it looks like bad press for them, they voluntarily gave it back. It wasn't that there was some oversight mechanism in the government to keep them from getting it. It was that they thought, oh, somebody's going to write a story about this, and we have to give it back. And this sort of de-emphasis or lack of investment in inspectors general, what we're seeing generally is sort of taking a part of the oversight mechanism of government that seems to be making it easier for some private entities to, as you said, sort of get these funds in the middle of this, but harder for individuals to get it. I mean, is there something bigger going on here behind the scenes? I mean, you could call it, some people say, well, this is neoliberalism in action. I've seen that written. To me, that's not satisfying. That's not an explanation. That's just a tagline.
So, and I'm taking a second to think, because as you say, to sort of unravel the entire and open up the entire political economy of the country in just a minute or two, challenging task. I think that is that without the kinds of close oversight and experience in observing how these programs typically go, there is less capacity and less ability to anticipate how powerful entities can perfectly legally, right, or more or less perfectly legally, manage to get access to those funds. Perhaps if there was a large fund of experience amongst regulators going back over 20 years that would look at how disaster funding has typically gone awry, maybe then there would be some modest chance of that. In these cases, I think we can credit civic outrage, civil society, moral outrage. We could be optimistic and think it was the better nature of these large entities that they gave back a couple $1 million, which is probably not huge to them, but which is massively important to others. I think part of that is maybe still a story to be written in terms of how that happened and how it could be made less likely in the future, because it has been part of the history of disaster, is that powerful entities manage to divert these, funds perfectly legally, or more or less legally,
Yeah.
but in a way that they're not really intended for. And part of that too, of course, is the haste with which the programs are developed. Like, again, $2 trillion in like 3 weeks, or whatever it was.
Right.
It's not surprising that there's some slippage. It's just, it's actually good that there was enough, I guess, monitoring of this from outside of the government itself.
Thank you for going down the line with me on this. And I didn't tell you ahead of time. I didn't expect us to go quite this far with this, but I think it's quite useful, because disaster research is much broader than people often expect. And the lines between what we can have historically thought of what kind of core disaster research is, the boundaries between that and public policy or economics are permeable boundaries. And I think right now in the middle of the pandemic, we're seeing that they should be more permeable. We should have more experts, I think, able to do what you can do, which is to talk about very specific relief programs and then talk all the way out at these sort of broader, more structural problems of, let's say, government oversight and disbursement of funds. So that's why I was glad we could talk about that.
Well, I don't know that I do it especially well, but it is sort of one of the, is one of the things that I think about is how in practice to try to bring these programs into reality, and to try to understand where the blind spots are in that. I think a couple of these documents that I mentioned sort of reveal that. I think I have no doubt that over the next several weeks we'll find other mistakes that have been made in trying to distribute this vast amount of money in such a short period of time. There is, and I guess to our benefit is there is a substantial body of experience in the sociology of disasters, in public administration, political science, and other fields that could allow us to wrap our brains around, how these assistance programs can go awry, how responses to disaster perpetually show the same interorganizational failures. So we can have some confidence in that.
I want to remind people you're listening to COVID Calls, and my guest today is Jim Kendra, director of the Disaster Research Center at the University of Delaware. And we still have time to get questions in, because I think Jim has been kind enough to agree to stay on a little bit longer, I hope. We've been talking very broadly. I want to focus back in. And I want to ask you about nursing homes. And in general, you've done some research with other sort of partners in the healthcare world more generally. Talk to me a little bit about what you're seeing there. In one sense, I guess, kind of expected and predicted. We watched what was happening in Italy, that the coronavirus was taking a particular toll on older populations. And yet, as Esther was saying at the top, these have become real hotspots in the United States. What's your take?
I think, once again, we should not be surprised at the, the particular vulnerability of those, of those institutions. As you mentioned, it is something that we've studied before, but there the setting would seem to be, unfortunately, perfect for an outbreak of this sort, where you have, in many cases, an older, oftentimes frail population, people living in very close quarters, often with hygiene problems that are part of the normal, part of normal operations, with a disease that doesn't give a warning, where people can transmit it, as we've learned, before they show any symptoms, and where the kinds of protocols that you need for infection control are very difficult to maintain. So I think back to some of the research that we did on Ebola a few years ago, and the intense training and watchfulness that the clinical staff would go through when putting on their protective equipment, from taking it off, training, watching each other, different teams overseeing the process to be sure that nobody made a mistake. And that was, in the United States, that was for a relatively small number of cases. And it was a very intense process of infection control. It's hard to see that happening in a nursing home environment or aboard a cruise ship, as we saw with, with some of those cases as well. Just the intensity of the protocols for personal protective equipment, for making sure that, that disease agents aren't spread. Like it's a massive job.
I want to get to a comment and a question here. It just came in from Kim Fortune. Kim says, it's a very important point that the military is limited example, going back to what we were talking about previously, that the military is a limited example of an organizational ideal. Strict command doesn't well prepare for the innovation that Jim Kendra is saying is so important. That's her comment. She has a question here, which I think is relevant to the DRC, and I wanted to ask you something along these lines too. How can universities help foster the disaster learning that hasn't happened? Going back to the sort of previous conversation we were having, there's a lot of knowledge out there, and yet it doesn't seem to always get implemented. The uptake isn't always there. What are the frontiers, particularly where universities can intervene? This is your business. Tell us.
In a few ways. Obviously, the teaching that we do in our courses, particularly our disaster science and management courses, whether of whatever name they happen to be called, from the bachelor through doctoral level, I think are important avenues for bolstering the experience base of emergency management officials, whether they're in the private or the nonprofit sector. One of the things that we consider to be one of our missions at DRC is public education and outreach, which means trying to be responsive to media calls when they come in, to help journalists present the best science as we know it. We try to be in contact with and helpful to local and state government or federal government as much as we can. So I think part of the task of a university, at least to my perspective, is to be a resource for learning and in whatever area the faculty have their particular competence. So those are probably the three good avenues for doing it: through the education programs, through publication and outreach, including the media, and introducing ourselves to and trying to be a resource for public officials.
So we're entering a period, I think we actually already, many universities have been in it. We're entering a period of austerity in universities, private and public. Doesn't that put interdisciplinary programs like disaster research centers in special precariousness in this moment? I'm worried about that places that are seen as that are often don't fall into one department, that cannot be protected as well in a university ecosystem, that they might in this maybe counterintuitively or ironically in this moment, that they may be specially endangered. Do you worry about that?
I think I have concerns for higher education in general, which are certainly heightened at this particular time. I think for the last several years in the United States, I would characterize as higher education as being under siege in a lot of ways, facing perhaps the greatest crisis of legitimacy that it's had in many years, decades. Influential critics talk about universities as being ivory towers where the students aren't going to get jobs afterwards, and so universities have been in a vulnerable position, I think, just in terms of the prevailing rhetoric in the United States. I think, though, that properly approached, this can also be a time for universities to show their worth, that they are sites of innovation. And we regularly see that engineering programs have been producing ventilators cheaply, that university professors who are in public health or epidemiology have been at the forefront of some of the dialogues on this. So while it might be a time of even further vulnerability, I think that with some with a little bit of guts, I think that universities can reestablish their legitimacy, reestablish their usefulness in the public rhetoric, and I think they should do so. I think that universities have expertise that is needed now, and should not be afraid to, to offer it either.
Well, I have opinions about this, and I'll be in the opinion box here for just a second, but just back to underline what you were saying. It seems to me at this moment, what's actually demonstrated is that every university and college, and with ones that specialize in vastly different things, from the arts to hardcore engineering to medical sciences, need disaster research centers that are explicitly interdisciplinary and that have done the work that you're just saying is important, and that is taking the educational mission, really important, the research mission certainly, but the educational mission, educating practitioners and trusting practitioners to be interested in the science, because they are, developing longstanding relationships with science communicators, including journalists, and then also developing as best you can these longer term relationships with policymakers, even though there's more art to that than science. And I can't help but wonder in a moment like this, if we didn't have, 50 DRCs or natural hazard centers like what, Lori Peak runs out in Colorado, wouldn't we be in a better situation? Now, I suppose you could say I'm an academic, so of course I think that, but we wouldn't be doing this if I didn't believe that. And we have to articulate that in this moment, I think, is what I'm saying.
Well, I agree, and that's that's the point that I was trying to make, and I think you said it better. But this is a time for universities and for faculty of really of every discipline to bring to bear the particular expertise that they have. I was reading in, I think it was Inside Higher Ed last week, about how in Germany, within the discussions on whether and to what extent to reopen, that scholars from the humanities, from the social sciences are in on that in a way that we don't have in the United States. But there is room for every discipline, because a crisis of this magnitude touches on every domain of knowledge. And again, I think this is where universities can shine, but we have to rise to it. We sort of have to confront this headwind with exactly what it is that we're able to do that is valuable. I think that in some ways universities have, academia in general, has fallen into that crisis of legitimacy, because we stopped being able to articulate in a relatively brief way what our value is. It's just something that we hadn't had to do, I think, for a long time. But now I think it's urgent. And here in this, this most compelling crisis, we actually do have something to say about it that can be useful.
So you wrote this tremendous book with Tricia Wachtendorf about the waterborne evacuation of Manhattan, 9/11. And what you were really writing about was networks of trust, expertise, competency, creativity, and improvisation that on any average day nobody sees, and then all of a sudden it's there. How do you think you're going to be applying some of those kind of lessons from that book into this COVID-19 pandemic?
So we will see either a maintenance of those kinds of networks or the forging of new ones. So, for example, when the restaurant that my wife and I go to, they're mostly closed, but they open up once in a while. And so we make a point of getting food to take out. It's not something we would normally do, but in this case, I think it is. So it's something that we want to do. So I think that we are seeing, a kind of connection across different facets of the community to try to keep things going. We are seeing different kinds of innovations. We're seeing, people are, I think, mostly, and I'll say that guardedly, complying with, physical distancing, because not everybody is, certainly. But I think a lot of the things that we wrote about in American Dunkirk are going to have their analogs in this situation, which is people trying to maintain their connections, people trying to think creatively, people trying to innovate. And those are the normal avenues of coping.
it has struck me that this is, again, not unprecedented, but unique in that so much of the violence of this disaster has occurred indoors and out of sight. And so that phenomenal waterborne evacuation that you and Tricia write about is, I mean, it was visible. I mean, it was happening and documentable in that way that you could talk to those captains. Do you think we're going to have problems doing research on this disaster because so much of it has occurred in private spaces and with practitioners who may not feel free to talk about their experiences? I guess my broader question is, how do you think, what are the unique research problems you think we're facing here?
Some of the things, well, some of the challenges that you've described will certainly come to the forefront. And I think, you know, how I would answer that would depend on what the particular subject of study is, or what the field of study is. Again, you know, as I said earlier, you know, disaster, you know, can somehow involve every aspect of human knowledge. So, you know, potentially scholars who are interested in, you know, in family and household matters, you know, they will perhaps find something at that scale that is very different than we might find, you know, at some other scale of social activity. So I've seen predictions that the rates of domestic violence will increase, which is probably one of the main ways that crime increases after disaster anyway, typically. It would not be surprising to see that again, particularly as economic stresses take hold. Mm-hmm. So I don't know that it will be more complicated, but it will fall out in different directions, if that makes sense. I think that too is a story still to be written.
Yeah, and I suppose any disaster we look at, there's so much of the information that's kept and guarded and not meant to somehow come out, and yet social scientists do find ways to uncover those archives or those troves or people who are willing to speak. And maybe it's too early to, this is my final question to you, is probably too early to ask you, but I mean, if you had to pick up one piece of this to begin some research on, where are you reaching first?
I think I would get back to a couple of the points that I made earlier. I mean, clearly the work that we're presently doing at DRC on adaptations within our local environs is something, you know, that I am going to pursue, you know, just because we're so heavily involved in that. But over time, I would like to turn some attention to these organizational disconnects and try to understand in more detail how it is that, you know, that these plans have these cutoffs that nobody can really see at the time. It feels like they planned, and they must have thought that, but then actual circumstances don't really connect to that. And I think that's one of the kind of the mysteries of planning. And if it really does come down to trying to know, you know, how an actual person is going to make an actual phone call to get the actual information that plan needs, that's what we need to know. That's where it falls apart.
Your visual image of coming to the edge of a universe and not knowing what's on, because it hasn't been filled in yet, is such a devastating one, and maybe an inspiring one to people too, that we have so much work yet to do. Jim, Kendra, I've been so selfish with your time, but really appreciate your sharing your insights and having this discussion with me today on COVID calls. I want to remind people that we're on COVID calls every weekday, 5 o'clock. And tomorrow I'll be talking to Chuck Strozier. Please do tune in for that conversation. It promises to be a really interesting one. Chuck is the former director of the Center on Terrorism at John Jay College of Criminal Justice in New York, and he's a wide-ranging historian who's thought particularly a lot about violence and the apocalyptic, and we will talk about that tomorrow. Jim, Kendra, thanks for coming on COVID Calls.
Thank you so much for inviting me. This was great. Thanks.
Stay healthy, everyone, and we'll speak with you tomorrow.